A child's first breath is one of life's most powerful moments. For generations, many Gambian families traveled long distances in search of medical care, especially during critical moments like childbirth.
All this investment is not for any other reason, it's to touch directly the lives of the Gambian people, to make sure that the suffering they are going through to see a nurse, to see a medical doctor, is actually eased.
And for sustainability, for independence in the way we do things, for ensuring quality, we have to get our own. That is what warranted the construction of this, under the instruction, the leadership, and the guidance of His Excellency, the President himself. So that's why we are here today. By the time this is completed, inshallah, it will be a state-of-the-art infrastructure that will go a long way in ensuring the well-being, inshallah, of the people of this country.
I think the government has a very good foresight in ensuring sustainability in the health sector. And the best way to do that is actually to train people in country.
Our investments are very strategic in terms of easing the burden of our citizens.
Today, across the country, healthcare services are moving closer to the communities that need them most.
Bakaramuro, Nensasara, Jaisano Janatarial, Yamur Karamo, or Jenin Casoro, Ekanajan Era Swokon, or do Buka Joran or Membe Sambal Kokenava, Esi Swokon, Asakeno Tulufula Tulisava, Bukara Karamo, Hona Narakam Baran, or Bello Plano Sorora, a question.
Janilo Plano Kana, Benyamin no, and be Benyamin Mankelia, Manyatu Tabas or the Bayotumontulkata Karantabale. Ngata boro nyini je talata o talata sinya kileng nin talata o sitan ka funtola sitin nga ramuta ni nga ramuta ngata hani moto nata moto nyinga mo konto menta ni o mo sotota hani te be sasari te be wolu bayila le bo talata o bayila le sai be talata ko tele batula
ar janni moto bina wo wici don tema ni muso kono ya ma waranto mo sasat a nkabata bak parce que taranko tem bulu jantu moto te jang masima te jang hani sareto luotumo sareto ate jang.
From regional hospitals to newly established health centers, the expansion of healthcare services is bringing quality care closer to the people.
Dumonintingo mo manka kolleke karda musa sata sina ina moto to ya samba Aita boro nyini aita loptano kena ba wulu me ya dandanga sija be laje fo fano wek par sa mbiri ne mo nata be ma sa talala ne mo lati nata mur ko take mbula tan loptano kon sa mbiri ngani loptano ni soto e katara suwo kono doron tingo e la moma ye kolke loptano te ko na mo sa sa tay na nakam aita wulu na wulu te ya na dingo tular la na gaita suwo kono yete ila fo la mula wulu te fo na ya le tara jang fo somo ay ya bulaita no solbe jang do ko nyimbe betaren ko loptano tare fe sate oto bilay mbadin tamamira nema tambita me aussi.
Under the leadership of His Excellency President Adama Barrow, the government of the Gambia has prioritized strengthening the national health system. Through sustained investments in infrastructure, the training of health professionals, and the expansion of services, the Ministry of Health continues to improve access to quality healthcare across the country.
The immediate vision of government is to have kidney transplant in the country, to have open heart surgery in the country. And that's going to be possible very soon because the German government, in partnership with the Gambia government, as part of the Gambia government counterpart financing, are going to build a multi-purpose surgical center in Farato, very soon. The process is ongoing, and we will launch the tender very, very, very soon. So the impact will be huge. And once we are done with 30 to 40% of the current work in Farato, you will see a huge U-turn. Instead of Gambians going out for treatment, you will see people outside the sub-region coming to Gambia for medical treatment. And that's very soon.
Strategic planning plays a critical role in guiding national healthcare development. Through policy formulation, monitoring, and digital innovation, the ministry ensures that health programs are effectively implemented and continuously improved.
Learning from COVID-19 and maybe a bit earlier, the government of the Gambia, through the Ministry of Health, has also instituted regional rapid response teams in all the regions. So we have core sets of people who can respond to outbreaks at the regional level. So these things are just things related to the human capacity. But also, if we go a little bit looking at the systems we use, we've moved to a good extent away from paper-based systems, electronic systems, both for aggregate data, for case-based or individual data, and laboratory data.
Delivering quality healthcare requires skilled professionals, well-equipped facilities, and efficient systems that support patients at every level of care. At the same time, preventing disease and protecting communities remain central to the country's public health strategy.
There's a lot of improvement regarding the functionality of the hospital. For example, now we have our own pediatric surgeon. Until now, most of the pediatric surgery cases will travel outside the Gambia. And then, that's where they get the care. But now, we do them all here, almost all of them. So the specialization has really helped. Now you have, for example, the urology now. They do TOP, they do very advanced surgeries. You have endoscopy. Those who used to go to Senegal, now they can do it here. So this, what it does is, because, for example, if you have to send somebody to Senegal, their ticket, the family they go with, if they go there, they have to start the test all over again. It's not conducive at all, and it's very expensive. But if you have to do it in Gambia, it's less expensive and less troubling to the patient, and you have a better outcome.
Across regional hospitals, such as Basse District Hospital, dedicated healthcare workers provide critical services to hundreds of patients every day.
So, beginning with, let's talk about the public health unit. We have the surveillance. So then surveillance was not very advanced. So disease surveillance was just limited to certain areas. But now with the coming of we've trained more surveillance officers. So we have the number, the human resources, more public health officers. We're able to do a surveillance report of the entire region. Whatever is happening here, we have an update of what is going on.
Over the years, if you look at the government budget, you see that the number of health workers being absorbed is increasing gradually, year by year. And this also enabled the Ministry of Health to be able to deploy health workers more and more into more and more remote areas. So if you look at, for example, the number of public health officers we have, it has more than tripled in the last few years. And because of that, the number of health facilities offering immunization services that have cold chain systems are now over 113 of them.
At the Edward Francis Small Teaching Hospital, specialized services continue to expand, strengthening the country's capacity to manage complex medical cases. Across regional hospitals, such as Basse District Hospital, dedicated healthcare workers provide critical services to hundreds of patients every day.
So Basse District Hospital is the only district hospital of the Upper River region, and this is also one of the farthest region in the country. And it's where we offer a lot of services. We have a catchment area of more than 97,000. And also we see surrounding villages around the Senegal and the border. We don't only see Gambians, we also see non-Gambians. We offer a broad range of services, ranging from obstetric and gynecology services, medical, surgery, pediatrics services. We also art unit, we also have an eye unit, also the art clinic. We also see ENT, those that we can manage, then we manage. Those that we can manage, then we send to the next level. Because of is the nerve center, I call it, of the Upper River region, we have a lot of referrals that come in here because it's clear that we have a theater, that cases that can be managed in the periphery, that case that needs surgery, that they have to come to the Basse District Hospital to get their definitive management.
Across rural communities, new health centers are bringing essential services closer to families who once traveled long distances to seek care.
Wotumo nintuŋo musomuta ñantari fada bañul ka ko ndol wasangata dol bo kafuta dol ka wulule dingol ye bang o dol fanay wulu ye dingol tukom ko be mu ko ya ko
1996 la sey fi ci sama jox waye lima sey yep ci ciono la nek ngir lan man buma ëmbé kunta yalla ay fajoji buma démé lab esso la démé lab suma ay wasin kunta yalla ay wasini té lol yep ciono la lima dox di wasin yep musuma dugg moto ndax moto yi amut fi benn moto moo fi ne ole yar la mun naa jóg fekk sama taami moto jotut mun naa jóg fekk suma doom feebarut sareet lañ maa takkal sareet bi mun naa nekk sareeti mbaam mun naa nekk sareeti fas bala maay àgg mun naa loru wala suma doom mun naa lor ndax dal na ma benn yoon maa suma biir bi di métti ma war a dem hôpital pour uti garab waaye coono bi ma jànkuwaate tax na bi ma demee biir boobu noonu fekk maa ngi nekk 4 months dafa mujjoon tuur noonu laa tëddee Kuntaya am fa 1 week ñu discharge ma ñëw di naan garab ba bi ma amaatee loolu yëpp coono la woon fii.
ndungu so tawi an ko gerte ndemɗa ko so yeehi ha a yeehi gerte ɗe mbawta dañde haalis so tawi noon an a fawaɓe e nder ndungu ete ala haalis a wawata ñawdude ɓiɗɗo ma a wawata ñawdo an e hoorema ɗon ko miijotoɗa ko ñamɗa surtout noon so tawi aɗa ɗaɓa ko ñamɗa ha so tawi pawle ari e dow ɓiɗɗo ma walla ari e dow ma ɗum ɓeyrima addan caɗele ɗum wonino ɗo hanki
data bo affaire yi wasini moo ñu daanaka moo doon tax ñu doon rifa nit ñi parce que li si des am na fi fu mu toll nii développement moom yokku na léegi moo gën a baax ni bu njëkkoon waaw léegi moom dégg moo gën a baax ni bu njëkkoon bi loolu amee nag dañ la daan jël yóbbu la Banjul léegi lu bari suñ théâtre bi mu ngi dox am nañ docteur te time boobu amuñoon docteur waaw léegi am nañ docteur am nañ yëpp loo bëgg a si wàllum faj am na ay fu mu toll nii.
The numbers have increased because especially with the obstetric service, like I said, sometimes we receive some patients up to from Badibi area. Though it's a bit far from here, but on certain occasions we do receive patients from Badibi. So and then also from the neighboring country, Senegal, people come here for service. So the numbers have increased and it's increasing every day. Even if you go to the ophthalmology, the ophthalmic services, most of our patients are coming from Senegal. So this upgradement of the facility has increased the patient income. So we are receiving more patients now than before.
So the coming of this facility has been a big relief for the people of Jokado, definitely, because I understand from our data of last year, we had a minimum of close to 8,000 patients just at the OPD. So, and deliveries here, our average is 25 to 30 a month. That excludes the antenatal care. Last year, our antenatal service was around 4,000 for the year, just antenatal services that we do. So we have 5 outreach areas and 1 base currently. So we go to trek in all these places. So before this facility, Kuntaya was taking care of all of this, and most of them will go and meet them. So you can imagine before this facility, there was a big struggle. But the coming of this facility definitely have been a big relief for the people.
When this new facility was upgraded, it brought the healthcare services to the doorstep of the people living in the community here. Because just as what the committee members said, before, the women used to deliver at the home delivery. They used to conduct home deliveries or on their way to the hospital. But now, with the help of this upgraded facility or the new facility, now majority of the deliveries used to happen here. We conduct them here with no complications or delay.
It's an exciting day today here at Jali Health Center. We just delivered a bouncing baby boy. Both mother and child are in good conditions and both healthy. There were no complications, and this is why we do this, the job we do and the services we deliver.
Moments like these highlight the importance of expanding healthcare services to every corner of the country. For families in communities like Kiang Jali, having a health facility close to home can mean the difference between uncertainty and hope.
The plan on bila sodra ay nyarta mendina o nyarta ji warta bak kadum follow ni atra kono le dimidron ini mboro sinale plan re borota ni atra mol mi alon tingola ma ye le men no soli ye kuma fo don ini borota wal hani ma kuma no soli ni isi so ni sanya moro samana ay na fo le plan to jang ya ja si wulu bulu jang na ma wulu ne bulu jang ya samba jara soma. Okay, ana boro ko renje isa yako dinni woni fana ni dinni woni problème wala so da sasat le bang ini mboro sina nya moto nano ine na fulaje na sam. Okay, birwol beketa way nyaaro tal mendina warta
ngalo nyaa ni leptano be karamu e shato to aka karamu ndo dinul mako ila karamu ka tadde bay ni mina ni na da leptano han yem wol tara sharing e ka opportunity di lollale yetol trido ye muru yete la karamu continue ba wotu monu ni tada ni karamu ndo dinno ni shasha ma wala watilo mumo be aka fola ko shakata damen do aka tilo mumo kejele wolu mumo abukata akaramu bar alhamdulillah sha bilin ni shododa ni shasha e ma karamu do don ye nana njallaptano do don abukata mi 15 minutes ato ye murna ye continue la karanga o fana mala nema kol dolde.
As the country continues to invest in modern health infrastructure, strengthen human resources, and expand community healthcare systems, the future of healthcare in the Gambia continues to grow stronger.
Previously, we only had one delivery room. Privacy was not that much very high. But with this new renovation, the delivery rooms, we made so that it has cubicles. And each person, each woman has that privacy wherein you can bring your partner or your husband so that men can also be involved and know the challenges that women are undergoing.
With the new maternity coming, the impact is that men will be coming and they can stay with their husband in the labor room, and then decisions could be made earlier, and then action can be taken earlier to avoid consequences that might come in. So it's really going to impact a lot in the service delivery.
That will also have an impact in family planning, because it will change the perception of men with regards to delivery. Because if they see what women undergo, if you accompany your wife into labor and you see how labor is, then if your wife tells you, I want to do family planning to at least help to space for the children, that man will really agree.
Bi mbetunkumunto bi ita amulian nola bila kadon bi yirwa mumbe mbwalen kanang anin ben siumbula ka yirwa mun kono bi nyato ta doron na bije anin be nyato ta doron na je kan anun hanin bota sain be tembo men do hanin bota yin tembo to be fulara lado fananto ada kala ko komen ada kala nyato ta baleti ada nda kala nyato ta yirware baleti bana.
With this renovation, our referrals to Bansang are very, very high, because for simple procedures, especially CS operations, that cannot be done here because we don't have a theater. But with this renovation, now we have a theater, although it is yet to start. But we are with the hope that if this renovation is completed, the theater will start functioning. That will reduce the amount of referrals that we take, which will reduce the burden on Bansang and in general the country, because referrals are not cheap. So So the more we reduce the referrals, the more we are helping the government. And that is not alone, because we only had one small room where we call a kitchen. But now we have a utility building and also a maintenance unit, where that utility building has a kitchen, a laundry room, and also a general store, which was not available before the renovation. So that you can see that this renovation has really helped the natives of Lower Fuladu and also the staff working here.
We want to expand, we want to build more beds so that we can accommodate anybody that is sick in this country will be accommodated in a very comfortable facility, and that is far. And health is wealth. Without health, you cannot walk. So it's important for us to make sure that our health sector is in order. If you look at how much money we are spending for people to go outside for treatment, we're spending a lot of foreign currency. We want now people to come here, health tourism, so that people will come outside and have treatment in this country, and that will bring us foreign currency. So these are the advantages, and we will keep our people in country rather than traveling to Senegal or traveling to other countries for treatment. So we are improving with our facilities to a level whereby if you are sick, you can be treated in this country. We want, if the minister is sick, be treated here. If the president is sick, he'll be treated here. This is what we want. We want to make sure that that social gap, we close the gap.
Through these collective efforts, the government of the Gambia remains committed to building a resilient and inclusive health system that serves every citizen.